Good morning and welcome to another episode of podcast. I'm Shalini Sundarajan and I have here with me Trey Davis from Sun Life Health Center. Thank you for being here with us, Trey.
Thank you for having me.
So Trey, I know we are going to be talking a lot of exciting things today on this podcast, but before we get started, can you give us a little bit of an introduction on your clinic and how you're set up?
Well, I am the Director of Information Systems at Sun Life Health, located in Casa Grande, Arizona. I've been with the organization for going on 9 years now, and one of the highlights that we have going on right now, we're in the process of building a $65 million campus,
Wow.
which will be the largest building in Casa Grande, which will be 4 stories, and we'll be providing additional services to our community, which will be a real benefit to all of our patients. So it's going to be the shining star of Casa Grande.
That's fantastic. Congratulations
Thank
on
you so
that
much.
and all the very best.
Definitely.
So today we're going to be talking a little bit about Sunoh and how that has helped you and your clinicians. So maybe what you can start talking about is how has Sunoh really enhanced your productivity?
So with Sunoh.ai, we've been looking for products to kind of help enhance our provider workflow and give them the additional tools they need to be able to see their patients efficiently. We've went through a number of different products, even things like virtual scribes and things that are pretty costly. And once we had the AI product that came live, and I believe it was like last year we saw it, and we were able to get it deployed in our clinic. We started off with a few providers, and it just took off from there. It spread like wildfire. I was getting calls like, okay, why do they have this and I don't? And some providers were like, oh, I want to try it and see what it does. So there's a lot of parts to it that are very, very good, a lot of features that we truly love, and it just gives us that extra tool to kind of enhance our visit. One of the key features that I do love is that the fact that whenever you complete your progress note, you're really seeing a story of what happened in that visit. So there's no misunderstanding of what went down in that room. So, and the patient hears what the provider's saying, so then you get your instructions as you're going through that visit.
Wow, those are all some really, I think, points that what you made makes it unique and helpful. And on a recent podcast, press release, you mentioned that you conducted over 300 visits in Spanish using Sunoh. Can you speak a little bit to that?
So we do have a very large Spanish-speaking population in Arizona, and having those visits and trying to translate those manually takes a lot of time, a lot of effort, and there's a huge possibility of error because there's different dialects in Spanish also. But Sunoh.ai has been able to pick up the Spanish and then put it into the progress note, and then the versatility of being a provider that may speak English and Spanish, and they're going back and forth. It breaks it up that way also.
Oh wow! So that's a very important feature that you mentioned. That I know Girish mentioned yesterday in his keynote, Spanglish, the term he used, is a combination of English and Spanish, and Sunoh still is able to pick up and still able to translate it accurately. And we have you, to attest to that, so thank you.
Right.
So let's talk a little bit about implementation, right, and go-live strategies. Someone your size, I think you're constantly thinking about, well, I'm implementing this really important and big initiative. So what was some of your plan, your implementation strategies, maybe your testing? Can you speak a little bit to that?
So the biggest part that we went through is making sure that the product was what we wanted. My clinical applications manager, Claudia, she went through and tested everything, and making her a believer, because she didn't make it to the conference last year and she couldn't see it. So making her a believer. So once you believe, you get excited about it, and then you go to your first provider and you tell them about it, and they're like, that won't work. Then you show them, and the setup process is so simple. It's literally one paragraph. They read that paragraph, it's set up, and it's ready to go. So being able to deploy it quickly without taking up a lot of the provider's time was one of the key features that we were able to show them. So once they got the product, they just kind of ran with it, came back, well, it's not picking this up. Well, let's see how you said it. So we were able to play the recording back. This is what was said. This is how you said it. So it's picking up exactly what you said, but as it progresses, it learns the things that you say and the way that you say things. So it was a very, very learning intensive piece.
Wow. And what they say, seeing is believing, right?
Yes.
We can definitely tell them all the wonders of Sunoh, but when you start using it, you start believing in it. Thank you. Is there any advice you'd like to give our, the our audience who's considering, starting to use Sunoh at their practices?
Well, definitely. Find that one provider that is the naysayer, the one provider that you will struggle with introducing new technology. Get that provider to try it. I promise you, you won't regret it. Once that provider tries it, I guarantee you it'll be 24 to 48 hours before you hear from them. They'll be enjoying it. And then if you try to take it away, they won't let you. So, it kind of starts with that one provider. So you want to give them that tool, let them pick it apart, let them figure out, what the issues are, if there's an issue. We didn't run into any issues, and our providers have been loving it ever since.
That's fantastic. So besides Sunoh, what other AI features have you used in your clinic, and how has that been helpful to you?
So one of my favorite products with the AI features is the one in the fax inbox, where we can it automatically matches to the patient. That saves so much time when you're searching for patients. You're scrolling through the document, making sure you have the patient names. The AI picks it up right away. So we're able to file that paperwork quickly and get it out of our fax inbox. And we probably average around about between 6,000 and 10,000 documents in our fax inbox at a time. And it just allows us to move through those documents quickly. Another feature that I like to use is on the scheduling. We're able to search for appointments on a provider's schedule, and we were just talking about it yesterday, how great that is, especially if someone doesn't really understand how the full scheduling application works. They can just search for an open slot for our provider, and it pulls up the next available depending on what you want. Like if it's a sick visit or a hospital follow-up, it'll pull that up, and I think that feature is great. And then for the admins, you have the admin search when you're looking to set up some admin stuff in there also, so that's very helpful.
Wow, all these are very, very, good features that's helping, the admin, the front office staff, better do their job easily, reducing number of clicks, reducing number of steps. Thank you. And any advice to our audience that's considering using these AI features, functionalities?
If there's any hesitation on your part, just jump in and go for it. The benefits outweigh the cons. AI is the future. There's AI in everything. I just got a new iPhone. There's new AI on the iPhone that's coming out. So it's involved. Use ChatGPT. It's all there. So embrace it. We've been waiting for this probably ever since we've had EMR. It's something to enhance our productivity and just give us a tool that it's actually fully useful. And it kind of breaks down all the barriers and walls around documentation.
Yeah, you're absolutely right. And one thing I also tell some of my clients is that if you don't move forward, you're going to be left behind.
Definitely.
So let's all move forward together. Well, thank you so much for your time today, Trey. And thank you for being here with us. Thank you, everyone, for tuning into our podcast. We'll see you next episode. Thank you.